In medicine, some of the most difficult decisions you can imagine hinge on just two simple-sounding words, ordinary and extraordinary. They seem straightforward, right? But in the world of bioethics, what they mean can be the difference between providing real comfort and causing a lot of unintended suffering. So let's dig into what these terms really mean.
To really wrap our heads around this, let's start with a hypothetical case. Imagine a 15-year-old patient. They've been diagnosed with advanced liver cancer. And the prognosis? Well, it's grim. The doctors have determined there's no real hope for recovery.
So the medical team suggests that aggressive treatments like radiation would be an extraordinary measure, especially given the burden it would cause. But this completely confuses the parents. They say radiation seems to be an ordinary procedure. We don't understand why the doctors would describe it as extraordinary. And you can see why they'd think that, right? Their question makes perfect sense, and it gets right to the heart of a really critical misunderstanding. So that's the big question we're tackling. How can a totally standard, common medical treatment like radiation suddenly get labeled extraordinary? The answer, it turns out, isn't in the treatment itself. It's all about the lens you're looking through. Okay, so the whole issue really boils down to this. One word, but two completely different professional meanings. We have to pull apart the medical definition of ordinary from the ethical one. They're not the same thing. And this slide is where it all becomes clear. On the one hand, you have medically ordinary. That just means it's an accepted or standard procedure. Think of something like radiation therapy. But then you have ethically ordinary, and this is a whole different ballgame. A treatment is only ethically ordinary if it offers a reasonable hope of benefit, and, this is key, if it can be used without excessive pain, expense, or some other major burden on the patient. It's totally patient-focused. So there's the conflict, right there. The doctors, they were using that ethical framework, carefully weighing the burden of the treatment against any potential benefit for this specific patient. But the family, they were thinking in purely medical terms, seeing radiation as a standard tool you use to fight cancer. The thing is, both sides were right in their own way, but they were speaking completely different languages. And that leads us right into the ethical calculation. The main principle here is that the ethical viewpoint shifts the focus entirely away from the treatment itself and onto the person receiving it. It's not about the tool, it is all about the patient. Now, this concept, this ethical idea, it isn't new. In fact, there's a formal definition that goes all the way back to 1957. It says that ethically ordinary means are, quote, all medicines, treatments, and operations which offer a reasonable hope of benefit for the patient and which can be obtained or used without excessive expense, pain, or burden. The key words there are reasonable and excessive. It's all about what's fair and manageable for the person going through it. So, we can break that formal definition down into 4 key factors. When you're trying to figure out if a treatment is ethically ordinary or extraordinary, you have to ask these questions. First, is there a reasonable hope of benefit? Second, is there excessive expense involved? Third, will it cause excessive pain? And finally, are there other major burdens on the patient, on the family, or even on society? So here it is, the single most important point. Ethics demands that we look right past the name of the procedure and focus entirely on the patient's unique, specific condition and their circumstances. A treatment isn't just extraordinary on its own, it becomes extraordinary for a particular person in a particular situation. All right, so with all that under our belts, let's go back to our story. Let's apply this new framework. How does this ethical distinction actually help resolve the family's dilemma? And more importantly, help guide patients through these incredibly tough decisions? Let's walk through the doctor's thinking, step by step. First, they absolutely acknowledge that, medically speaking, radiation is an ordinary, standard procedure. No debate there. Second, they assess the situation and see that for this patient with such advanced cancer, the treatment offers no reasonable hope of benefit or recovery. And that leads them to step 3. They conclude that going ahead with it would just impose an excessive, awful burden of pain and suffering. And that leads to the big aha moment. The crucial conclusion. A procedure that is medically ordinary became ethically extraordinary in this case, simply because the burdens just far, far outweighed any potential benefit. See? The label isn't fixed. It changes based on the patient's reality. And all of this brings us to a really profound ethical principle, and it's this. Quote, "There is no duty to make use of ethically extraordinary means to preserve life. This makes it so clear that choosing not to go through a burdensome treatment that has little to no hope of working, well, that's an ethically sound and deeply compassionate choice. It's not about giving up. In many ways, it's an act of love. So in the end, this whole distinction isn't just some academic debate, it's profoundly empowering. It gives patients and their families a real framework, a way to make decisions that are based on compassion and what's real for them, not just on what's medically possible. So I'll leave you with this to think about. How does truly understanding this difference empower people to navigate their absolute most difficult moments with more clarity and maybe even a little more confidence?